Thank you for listening to Depictions Media Radio. Okay, so in the past week or so, there have been questions about the AstraZeneca vaccine. Is it safe? Is it going to do harm? Because there have been reports of blood clots and questions about if it is safe for people over 65. And while after the following recording does come up from the press conference with PAHO, that a European agency has actually stated that the AstraZeneca vaccine is going to be safe. It's not related to any of the blood clots that they previously thought it could have been causing. So let's hear what PAHO has to say as they have delivered through COVAX to many different countries vaccines, and we're going to see many more countries come on board after the AstraZeneca vaccine problem has actually been resolved. So let's listen. Thank you for listening to Depictions Media Radio.
Interpretation into English, Spanish, and Portuguese and French, and you can click on interpretation at the bottom of the screen. Today, our director, Dr. Carissa Etienne, will be reporting to you on the current situation of COVID-19 here in the Americas. We will also be sharing an update on the situation in the region. She will be reporting on the supply of vaccine through the revolving fund. With Dr. Etienne today, we have Dr. Jarbas Barbosa, Assistant Director here at PAHO, Ciro Ugarte, who is Health Emergencies Director here at PAHO, and Dr. Sylvain Aldiguieri, Incident Manager, also with PAHO. And I am going now to give the floor to Dr. Etienne to share her words with us.
Good morning, and thank you for joining today's press briefing. Over the last week, nearly 1.3 million people became sick with COVID-19 in the Americas, and almost 31,000 died because of this virus. Today, we're seeing the virus pick up speed in about half of the countries in our region. The United States and Mexico are reporting a drop in new infections, while cases in Canada are accelerating, particularly among young adults ages 20 to 39. As new infections are decelerating in the Caribbean, many islands are reporting a rise in COVID-related deaths, including a doubling of COVID deaths in some islands. Cases are on the rise in many South American countries, like Uruguay, Ecuador, and Venezuela. In the last week, Paraguay's health system issued an urgent warning as hospitals have filled with COVID-19 patients. Major cities like Lima and Rio de Janeiro have imposed curfews and lockdowns to control recent spikes. Brazil is now reporting the highest number of new infections in our region and the second highest COVID daily death toll in the world. Several areas of Brazil are witnessing record high infections, and hospital beds are nearly at capacity across more than half of Brazilian states. The situation in Brazil is a cautionary tale that keeping this virus under control requires continuous attention by public health authorities and leaders to protect people and health systems alike from the devastating impact of this virus. Data must continue to be the eyes and ears of our response, and local and national governments must act at the first sign that infections are on the rise by implementing measures to slow down transmission. We cannot afford to wait. Let me give you a brief outline of vaccine update. As of today, nearly 138 million doses of COVID vaccines have been administered in the Americas, although just 28 million of these doses have taken place in Latin America and the Caribbean. Last week, the WHO issued an emergency use license for Johnson & Johnson's COVID-19 vaccine, making it the fourth vaccine to be authorized by WHO. By offering protection with just one dose, the J&J vaccine promises to accelerate vaccination efforts. COVAX has secured over 100 million doses of the J&J vaccine in 2021 and up to some 500 million throughout 2022, with doses expected to start arriving in July. The good news is that vaccine deliveries are picking up throughout our region. Every COVAX participating country in the Americas knows exactly how many doses they will be receiving before the end of May. And PAHO's revolving fund is placing orders on behalf of our region and working together with UNICEF and vaccine manufacturers to organize deliveries as quickly as possible. Last week, COVAX and our revolving fund delivered nearly 400,000 doses to our region. Earlier this week, the first shipment was made to Jamaica. Over the next few days, our revolving fund will be delivering nearly 728,000 vaccines to 5 countries. PAHO has placed orders for more than 3.4 million doses so far. For all these countries, even those who received small donations earlier this month, these COVAX deliveries will enable the start of steady vaccination efforts. We are happy that vaccines through COVAX are being delivered, but we recognize that the need for more vaccines and sooner is greater in the Americas. There is still much work to do. Right now, we have just 2 vaccine manufacturers that are dispatching millions of doses to dozens of countries around the world. And this is a bottleneck that still prevents us from getting vaccines to every country at the same time. But shipments will become more regular as more doses are available to COVAX in the next few months. Next week, we expect that many countries in the Caribbean will start to see the first COVAX shipments arrive on their shores. Our goal is to ensure that every country in our region that is participating in COVAX receives their first shipment before World Health Day 2021, which is April 7th. And we are not stopping there. PAHO's revolving fund is working hard to ensure that countries know when and how many doses will be arriving every month so they can organize their immunization campaigns. With COVID vaccination campaigns underway throughout our region, we are at the beginning of the end of this pandemic. But while there's reason for hope, we must also remember that doses are limited, and it will be several months before we can rely on vaccines to control this virus. In the meantime, therefore, and especially as COVID transmission picks up in some places, our goal must be to save as many lives as possible by prioritizing early doses for those who are at the highest risk of infection. The healthcare workers who are treating COVID patients, the elderly, and those living with existing conditions must come first. As everyone else waits their turn, we must all continue to rely on the public health measures that we know work at controlling this virus. Even those that are vaccinated should continue to practice social distancing, to wear masks, and to avoid large gatherings. Stopping this pandemic will require both that we limit new infections and that we expand access to vaccines. So we must not let our guard down. Let's keep hope alive.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We are now going to move on to questions and answers. Let me remind you that you can write your questions using the Q&A button, include your name and media outlet so that we can coordinate. We already have several questions that have already been coordinated live with you. So if you can write there, we can coordinate better. The first question is by Katia Rojas Toro from the Panama News Media, and also Clara Nulia Valencia asked the following. A year after the pandemic has been declared, what is PAHO's assessment in terms of the health systems and their response to health crisis in terms of interventions, and have they been successful in this difficult test? Dr. Etienne.
First, let me begin by saying that our health systems are still going through this test. This crisis is far from over, and many places are now experiencing more cases than ever before. Nevertheless, there are many lessons that we've learned this past year, and let me just mention a few. The first thing is the importance of leadership. Time and again, we've seen courageous leaders coordinate an effective response based on evidence and science that has changed the course of the pandemic in many settings. But we've also seen the opposite, with the virus thriving whenever there is a vacuum in decision making, and which exposes the faults of our health systems. Let me talk about the second lesson. Our health systems were not effectively prioritized before the pandemic. We have relied for too long on a hospital-centric approach instead of strengthening primary health care, which should be both the entry point and a core pillar of our health systems. This has limited the effectiveness of our response to COVID-19, but at the same time has also disrupted essential services and thus weakening our ability to address other health issues during the pandemic. And the last lesson is that the economic well-being of a country is directly connected to the strength of its health system. Strong health systems are more resilient and respond better during an emergency, but they also recover better and faster after a crisis. This will impact, obviously, our future after the COVID pandemic. For several years, PAHO has been recommending an investment of at least 6% of GDP in health. And this point has been a passion and a priority for me. But it is a burning issue now, as investments in our health systems will make the difference between a quick recovery and a slow one. So we continue to strive to develop and strengthen our health systems even during COVID-19.
Gracias, doctora Etienne. La siguiente pregunta.
Thank you, Dr. Etienne. The next question is by Anna Ramdas, and this is in English.
Dice, can you please provide any information as to when Trinidad and Tobago will be receiving its supplies of vaccine from the COVAX facility? And also, is there a distribution list? How is the determination made as to which country gets vaccine first, second, third, and last? Dr. Barbosa, ¿podría contestar?
Yes, thank you, Owen, for this question. First, let me tell you that the first thing that the countries need to put in place is to be ready to receive the vaccines. All the countries in Latin America and the Caribbean are ready. They have adopted all the measures that are required. They adopted the regulatory measures, the licensing for importation. When we receive the designation of the country in the list, in the allocation list, we start immediately working with the producer and with the country to establish what are the best ways to deliver the vaccines to that country. So Trinidad and Tobago is ready, is waiting only for the deployment from the producer. The allocation is made by an independent committee that was established by WHO, CEPI, and Gavi, that are the three organizations that coordinate the vaccine pillar of the vaccine accelerator tools. This is trying to achieve a stratified and balanced distribution among the countries in the 6 different regions of the Americas. And also to ensure that both AMC countries and self-financing countries will be part of this list. The idea is that we are working together with the countries and with the producers to expedite the process, and that every country in Latin America and the Caribbean, including Trinidad and Tobago, will receive the first deployment in 3 weeks. So by the first week of April, all the countries will receive, and we are working with the producer to expedite the process of putting all the vaccines in the proper box to expedite the deployment in order to reduce these dates. Thank you.
Muchas gracias, doctor. La siguiente preguntas en realidad.
Thank you, doctor. We have several journalists that have questions regarding the AstraZeneca vaccine. Collins from Nicaragua, and also Ochoa from Mexico. We also have a question from Tanya Rich Cartwright from Daily Tribune in Bahamas, and also other journalists that continue to send us questions in the Q&A. And the question in Spanish is the following. It is, what does PAHO think about the suspension of the application of the AstraZeneca vaccine in some European countries due to thrombosis? Should it be used or should its use be halted? Dr. Aldigueri, could you please answer? Sebastian, the sound was interrupted. Could you please repeat your question? Yes, I do see I have some connection issues. I repeat the question. What does PAHO think about the suspension of the AstraZeneca administration in some European countries due to thrombosis? And what is PAHO's position in particular in countries where the vaccine has been shipped through COVAX, and whether this should be still used or the use be interrupted? Dr. Aldigueri. Thank you. Thank you for those questions that I will attempt to answer jointly. We are aware clearly of the concerns as a result of some disorders related to blood coagulation in some countries in Europe within the context of the COVID-19 vaccine administration, the vaccine produced by AstraZeneca, and also some European countries have halted vaccination with that vaccine as a precaution. So within this context, it is important to mention that the Risk Assessment and Pharmacological Surveillance Committee of the European Agency, EMA, has not identified a direct link between the vaccination and thrombosis that could be the result of several causes. Those events could occur in vaccinated individuals and also in individuals that have not still received the vaccine. The second comment is that the World Advisory Committee on Vaccine Safety with WHO is assessing the data that has been provided by the European Medical Association in connection with 2 batches of the AstraZeneca vaccine that were manufactured and distributed in Europe. We are awaiting the final outcome of that assessment by EMA. PAHO needs to report that those 2 batches that are being reviewed in Europe are not going to be distributed through COVAX in the Americas, since the doses that were allocated to the COVAX mechanism in our region are produced in India and the Republic of Korea. In addition to this, the surveillance mechanisms for those events that are allegedly attributed to vaccination in countries of the Americas that are already administering the AstraZeneca vaccine have not reported any warning signs in connection with the safety of the vaccine. There are no indications as to AstraZeneca vaccine issues in our region.
Que los beneficios de la
For that
vacuna
reason, and taking into account that the benefits of the vaccine exceed the risks, WHO recommends to continue using the AstraZeneca vaccine to address COVID-19 pandemic, as investigations are underway for the European cases, and we do not anticipate an impact on the distribution through the COVAX facility. I hope I addressed the concerns of the journalist. Thank you. Thank you, doctor. The next question is by Rodrigo Rosales from the Expreso in Peru. He's saying that in Europe they are already referring to a 3rd wave. What would be the impact, or what would be the implications of this 3rd wave for Peru and other countries where the health systems are inefficient, and whether they would need again to lock down their population, since they are referring to severe, this is also related to severe psychological, social, and economic consequences, among others. Dr. Ugarte, thank you for that question. Rodrigo, we have seen a surge in cases in those countries that have relaxed social distancing measures. In some cases, the onset of vaccination against COVID-19 has also created greater certainty, and that led to the population to reduce social distancing, also hand washing, and they have also attended large events. Given those circumstances, the chances for the virus to be transmitted to other people increase also, and that also increases the number and also the demand for health services, and the hospital beds and also the ICU beds reach a maximum. And we have already heard that there is a minimum distance of 1 meter among people. The hands need to be washed, and at the same time, large gatherings need to be avoided. All those measures have been highly effective. When the economies have closed down schools and have closed down the economy, the reopening has to take into account the epidemiology, the virus transmission, and also the demand for health services, so as to act in a safer way to continue to reopen the economy. The total lockdown and the closing of all of the activities should be an extreme measure reserved for those places that have high number of cases, extremely high number of cases. So it is important to continue to reduce transmission of the virus among people, and this is the best measure, not only for those countries that have systems at capacity, but also for those countries that may have availability within the health systems, and that may be a reason to reopen the economy. But clearly we have seen in several countries a third wave, and not even a wave. There is a surge, a significant surge in the number of cases when the measures are less rigorous. Thank you. Now I would like to give the floor to Christian Gumarsin from Global News Canada. Crystal, you have the floor.
Thank you so much for taking my question. I'll assume you can hear me all right. I'd like to get some more specifics about Brazil. You mentioned that the infection rates are rising, and that we're seeing hospital ICU occupancy becoming more of a problem. Can you go into a little more detail as to the rate of infection in Brazil and any specific areas that you're very concerned with? And you did also mention, it's a cautionary tale to do with leadership. Is leadership in Brazil leading to increased infections and putting other people around the world at risk? Thank you.
Thank you, Crystal. Gracias, Crystal. Doctor Aldiguieri, ¿podría contestar?
Dr. Aldiguieri, could you take this question?
Thank you, Crystal, for this, this series of questions. So, regarding the situation, what is happening in Brazil, the actual situation is the result of an increased transmission during the holidays period and later the carnival. So we have observed spikes 2 weeks after Christmas and now 2 weeks after carnival. So I'd like to highlight that during these two periods, the implementation of public health measures in Brazil was suboptimal in most of the territory, therefore triggering amplification of the transmission and the geographic expansion. As of today, we can say that the transmission of SARS-CoV-2 is high or very high, and in all regions of Brazil, and increasing at the same time in all regions of Brazil, the north, the center, northeast, southeast, and south. I would say that this is the difference compared to the 2020 pandemic wave. What we have now, this simultaneous increase in all the regions of Brazil. As of yesterday, March 16, according to reports from the Ministry of Health at federal level, all 27 federal units are states and the federal districts. All the 27 federal units were reporting an ICU occupation rate of more than 75%, and 20 of these 27 federal units were reporting more than 85% occupation rate. So, and also we are aware that many patients are waiting for beds for being hospitalized in ICU beds due to the lack of free beds. So, as PAO has clearly stated during many press conferences, the strict implementation of public health measures guided by the epidemiological indicators will be crucial to control this increasing transmission. These measures should be implemented and monitored by all level administration, including the state level. There are 27 federal units in Brazil, and also the municipal levels. This is key. Monitoring the situation and triggering the implementation of public health measures at all levels. It's important to mention, in the context of the circulation of many variants, at least 3 variants of concerns, three variants of concern in our regions. The public health measures, when strictly implemented, work against the variant. It's very important. And finally, it's important also to take into consideration that the rollout of the vaccination campaign will first save lives among people with risk factors, people with comorbidities. It is only in a second moment that, depending on the vaccination coverage in the general population, that the vaccine would have an impact on the dynamics of transmission. So I hope I have answered your main concern. Thank you.
Gracias, doctor. Tenemos
Thank
ahora
you, doctor. Now we have several questions about Venezuela. Nicole Shapur from Number News and Mariana de Barrios TV Venezuela say that Venezuela announced that it would not authorize the use of the AstraZeneca vaccine in their country's immunization program. Given this situation, will negotiations stop for the countries entering to COVAX, or will they continue, and will they negotiate for shipments of other vaccines? And also Mariana Soquet from Cocuyo asks, what is the diagnostic capacity in Venezuela, and do you know how many tests have been carried out there to this moment? Dr. Ugarte. Thank you very much for your questions. I think regarding the AstraZeneca vaccine, Dr. Alighieri has been very clear. There are several countries that are taking cautionary measures vis-a-vis some side effects, some adverse side effects of the vaccine, and we understand that in those under those circumstances, some countries have decided to suspend arrivals from the vaccine or shipments of the vaccine. Regarding the regulating agencies in Europe and others, when they make a decision and when the WHO has the chance to review the situation, then the countries will also review and now the access to the vaccine is still on for countries through COVAX, including Venezuela. The situation of access to diagnostic testing is increasing significantly in those countries where field visits have been carried on and where adjustments have been made. The diagnostics through antigen, the capacity is 300 per day, and the number of symptomatic patients in many of these places have decreased. Even so, the number of tests has increased by more than tenfold in some places, and therefore we estimate that the capacity to implement is there. There are still logistic limitations as well as operative limitations. However, the network is increasing the capacity, and one of the confirmations or proof that the tests are working appropriately is that Venezuela is reporting that there are larger numbers of cases in different areas of the country. So we estimate that with the adjustments that are being made, this information will be useful so that Venezuela can reduce transmission within the country while they begin to use the vaccines they have and while they are waiting for the additional vaccines coming through the COVAX facility. Thank you, Doctor. The capacity is 300 per day, and the number of symptomatic patients in many of these places have decreased. Even so, the number of tests has increased by more than tenfold in some places, and therefore we estimate that the capacity to implement is there. There are still logistic limitations as well as operative limitations. However, the network is increasing the capacity, and one of the confirmations or proof that the tests are working appropriately is that Venezuela is reporting that there are larger numbers of cases in different areas of the country. So we estimate that with the adjustments that are being made, this information will be useful so that Venezuela can reduce transmission within the country while they begin to use the vaccines they have and while they are waiting for the additional vaccines coming through the COVAX facility. Thank you, Doctor. Now I will give the floor to Jacqueline Bicheda from El Mundo, Ecuador. She has a question about vaccines in her country. Jacqueline, if you're listening, please, over to you.
No, creo que no.
Maybe she is not on, or maybe it's not working. Therefore, I will read the question from Jacqueline Bicheda from El Mundo in El Salvador. The question is, when will El Salvador receive the vaccines from Pfizer for the first wave, and why haven't they received any vaccines so far? Dr. Barbosa. Yes, thank you for your question. The initiative initially was to send an initial limited amount of vaccines to some countries of the world from Pfizer. In the Americas, 4 countries participated, Colombia and Peru, and they have already received their vaccine lots. El Salvador and Bolivia. El Salvador is going to receive the vaccines from Pfizer next week, and they received 6 days ago the first shipment from COVAX. 36,000 doses sent to the country from AstraZeneca through COVAX. And the next week, they will be receiving some doses through the first wave initiative from Pfizer. Thank you. Thank you, Doctor. The next question is from Matias Loquewi from Nescape in Spanish. And I would also like to give the floor to Matias for him to ask the question directly. Matias, if you're on, please, over to you. Yes, thank you. Good afternoon. I wanted to ask the following. Scientists in Argentina urged to close borders with Brazil because of the T1 variant transmission. Do you think this is the most advisable measure until that time when we have more vaccines? And is this true that this variant increases the risk of retransmission? Thank you, Matias. Dr. Ugarte, could you answer, please? Yes, thank you, Matias. Yes, the B1 variant is one of the causes of concern for some countries. However, the closing borders and limiting international transportation of both passengers and cargo is an extreme measure. In many cases, it has been proven to be not enough to limit transmission of the virus, especially its variants that have been identified and detected within the country already. So in this sense, the most adequate measures continue to be to rapidly detect cases, quarantining contacts, identifying contacts, and having access to health systems by moderate and severe cases, persons with moderate and severe cases. Some countries have indicated that there are reinfections of people who have already suffered from COVID-19, and these reinfections could happen in a limited number of cases. However, when there is a high viral load, especially when physical distancing, mask using, hand washing measures are lowered, and people attend large crowds, as we've said here before, this increases the likelihood of transmission. And this increase in the likelihood of transmission is, of course, something that increases the probability of reinfection and the increase of new cases and oversaturation of services, etc. Our recommendations are that national health systems evaluate their own domestic risk at the level of each one of the municipalities, provinces, in the case of Argentina, or country level, and the neighboring countries, and the origin of international travelers. As we know, there are some restrictions restrictions that are being implemented for Argentina for international travelers, including a PCR negative quarantine, etc., and emphasizing that the measures of control of infections and transmission of the disease are the measures that need to be implemented in every case before thinking of closing the borders, especially when the virus is already circulating within its borders. Thank you, Doctor. From Daniel Alberto Jara, Canal 19, TV Aire, Coronel Oviedo in Paraguay. Question is, what is the official posture of PAHO regarding what happened in Paraguay regarding provision of vaccines against COVID-19? Dr. Barbosa, could you give us an update? Yes, thank you very much. Yes, Paraguay is ready to receive their vaccines. We had a small problem, which was an administrative issue with Paraguay, but it's completely resolved now. The vaccines are ready, and they are at the distribution center from the AstraZeneca distributor from AstraZeneca in South Korea. And we're working with the manufacturers so that the vaccines may receive the authorization for exiting Amsterdam, which is the distribution center, so that they can quickly arrive in Paraguay. So Paraguay will be receiving their vaccines shortly so that they can begin with vaccination first of the healthcare worker and then most vulnerable populations. Thank you, Doctor. Next, Carlos Serrano from BBC News Mundo. Yes, Carlos, I would like to give you the floor so that you can ask your question. Carlos Serrano.
Buenos días.
Yes, hello.
En agosto del año pasado,
In
la
August
OMS
of last year,
alertó de que la
WHO
pandemia estaba
alerted that
cambiando
the
y que los
pandemic was
menores de 40
changing
años
and that people
eran
under
quienes más
40
estaban
years of age
propagando
were
el
those
virus.
who
Mi
were
pregunta es,
transmitting the
¿cuál es el
virus
estado
most
actual de esa
widely.
tendencia?
Could you please
¿Se ha
tell
seguido
me something about
bajando el
this
promedio
trend?
de edad de
Has
contagios y
the age
hospitalizaciones?
of contagion
¿Y
continued
cuál es el
to
estado
decrease
de esa situación
and for
en América Latina?
hospitalizations?
¿Si hay
And
algún
what is
nuevo
the
respecto
status in
a que
Latin
hay más jóvenes
America?
contagiándose y contagiando de
In the
COVID?
sense that there are younger people transmitting and becoming sick. Yes, thank you, Carlos. Dr. Alighieri. Yes, thank you very much, Carlos, for your question regarding the evolution of trends in the Americas. And I am talking about North, Central, and South America and the Caribbean. The trends continue regarding the case. Those people between 30 and 50 years of age are those who become infected the most and are the ones who most facilitate propagation and transmission. Regarding hospitalizations, there are variations depending on the country. For example, in Brazil, it seems that in some states in the Amazon region, the age for hospitalized patients was lowered. And these are preliminary data that are being studied, and we're working with colleagues, especially in the state of Amazonas, a state that has suffered because of a big wave of transmission between January and February this year regarding deaths in the region. Age has not had many variations. Most people who have died or most deaths reported are in people over 70 years of age, followed but much lower in the group between 60 and 70 years of age. I hope I have answered your questions. Thank you.
I think that Mr. Sebastián Oriel is disconnected at this moment.
Olá, colegas, temos problema técnico aqui.
Hello, colleagues. We have a technical problem, so I will continue with the questions while we have Sebastián back. My name is Paulo Lira. I'm also from the Department of Communications of PAHO. Sebastián, over to you. You're back. Yeah, so I apologize. I continue to have some technical difficulties. The next question is from Antigua and Barbuda in English. From Kadim Joseph.
Observer Media en Antigua y Barbuda. Dice lo siguiente. It is known that the COVAX facility has suffered due to vaccine nationalism and other.
Olá, sigo aqui com a pergunta que estava lendo.
Okay, I will continue with the question that Sebastian was reading, the question from Kadim Joseph from Antigua and Barbuda.
System has suffered due to the vaccine nationalism and other setbacks. Antigua and Barbuda and other countries in the region have University of the West Indies campuses and other universities. Does Paru see avenues in the region for vaccine development and or production through these institutions or other? And she has a second question. And is Paru confident that it will get enough vaccine doses, such as the second doses, and they will be delivered under the program in good time? So the question, I think, Dr. Barbosa, if you may please answer.
Okay, thank you for this very important question. First, I think that you are correct. We need to discuss how we can reduce the vulnerability of Latin America and the Caribbean. Not only about the vaccines, but also for essential medicines, for personal protective equipment. This was a very important topic that was highlighted by the pandemic. Many countries in Latin America and the Caribbean, they had to struggle to have access to PCR tests, to medicines, now to vaccines. So we do believe that this is the moment to discuss how we can ensure more collaboration among the countries in Latin America and the Caribbean in order to strengthen the capacity that they have to produce these very essential healthy products. This will be a very important topic on the agenda of our governing body cycle this year, the Directing Council in October, when all the ministries of health will come together. And we do believe that this will encourage the collaboration between the Ministry of Health, Ministry of Finances, Ministry of Industry and Commerce, private sector, academic institutions, in order to come together to reinforce the capacity of the region to produce vaccines and other very important health products. This is indeed important. The deployment that is being provided by the COVAX facility to the countries will be a sustainable one. We have data showing us that March and April will not be easy months. Even May will still have limited access. Starting June, we will have more access to vaccines. So it's very important for the countries to use in a very wise way these vaccines, vaccinating first the most groups that are more exposed to get the virus, such as the health professionals. After that, to use the vaccines to save lives, protecting the most vulnerable groups to have severe forms of the disease. WHO has released today a very important recommendation that the countries using the AstraZeneca vaccine. Now, we have good data showing that they can use the second dose, they can schedule the second dose for the 12 week after the first dose. So this will provide more time because the data is showing that the vaccine is very effective after the first dose, and the second dose that is given after 12 months will reinforce the protection. So the countries can schedule to the last period of the range, so they will make they will use better. The vaccines that are available. But this is the recommendation that the countries need to adapt to their national immunization plans that they have in order to provide the best use for the vaccines that are being available to them. Thank you.
Gracias, doctor, y gracias, Paulo, también.
Thank you, doctor. Thank you, Paulo. The next question is from Uriel Velázquez from Despacho 505, Nicaragua, and it reads, the government of Nicaragua has not yet started to vaccinate healthcare workers, despite the fact that they received doses from COVAX of Russia and India. Is there a specific recommendation about how or who to vaccinate? It had been said that the priority was going to be among the healthcare workers, but this is not happening. Thank you for your question. Let me emphasize the work of PAHO with the countries, with Nicaragua and with other countries in the region, not only Nicaragua, but other countries in the region. PAHO provides technical cooperation to prepare their national immunization plans. They provide guidelines, recommendations, and they also support training for vaccination staff and supports many times the logistical aspect. Each country, however, determines what their priorities are in their own vaccination plans. Almost all countries have identified healthcare workers as one of their priority groups. And in this sense, Nicaragua, which started vaccinating, announced that the elderly, people over 60, and people with chronic diseases and healthcare workers would be among the first groups to be vaccinated. I understand that the authorities at some point in time will report on the status of progress of vaccination or advance of vaccination, and we will see how the protection of the healthcare workers is progressing. This is one of the highest risk populations. But as long as the vaccine, or not until that time, as we have had enough people vaccinated, will we know about the efficiency in the vaccination process. Vaccination processes take a long time. So the recommendation for Nicaragua, as well as for the rest of the countries, is to maintain the measures using masks, physical distancing, hand washing, and avoiding crowds. Thank you. Thank you, Doctor. We are coming to the end of this media briefing of today, and the next question is from Marta Cortet from Diario Contrarréplica from Mexico, and Jacqueline Villeda from El Mundo in El Salvador asks a similar question. These are questions related to possible increase of cases because now there are vacations, holidays, and are you at PAHO afraid that this will lead to more infections? Dr. Etienne, over to you.
As so many families know by now, COVID remains a serious threat, and therefore we cannot let our guard down. We have learned that if we relax, the virus comes back, but often with greater intensity. And many people are experiencing pandemic fatigue, but the virus is not tired of us. And when we relax protective measures, it spreads again. And unfortunately, transmission occurs when we gather in groups together, especially indoors. And it doesn't matter if it's a holiday, if it's Christmas or spring break or carnival, a family reunion, a business meeting, or a party can be the very situation the virus requires to spread. So it has become a pattern now that when communities relax during holidays or vacation seasons, transmission in that area tends to increase. Yes, vaccines bring us hope, and yes, they are a key tool to stop the spread of the virus one day. But until enough people have been immunized, we need to maintain the public health measures that we know work. And we've said that repeatedly. Right now, there are not enough vaccines in any country to protect everyone. we must keep the virus transmission down. So while the pharmaceutical companies ramp up production and delivery of vaccines, we must ensure that we take those public health measures. To avoid resurgence of the virus and to protect our health systems, the basic public health measures remain the very basis of the pandemic response. For public health authorities, this means continuing to conduct screening, contact tracing, isolation, assisted quarantine, and to provide quality care. And for the general public, it means continuing to practice physical distancing, hand hygiene, the use of masks, adequate ventilation of indoor environments, and avoidance of crowded spaces. I know we sound like a stuck record, but we have to reiterate this over and over again. COVID-19 has not been defeated yet, and we all need to keep up the fight, fighting that virus to prevent new outbreaks. And this often leads to more hospitalizations, the outbreaks that is, and can lead to collapse of health services, and most importantly, avoidable deaths. So please, we beg you, we implore, don't let your guard down. Ensure that you adhere to the public health measures.
Muchas gracias, doctora Etienne. Ahora
Thank
sí.
you very much, Dr. Etienne.